Have you ever wondered if you can reverse type 2 diabetes? It's a question that's crossed many minds, and today, we're going to explore it together. We'll journey into the realm of type 2 diabetes, debunking myths, and addressing the big question. Can it truly be reversed? Is it a life sentence? Or is there a glimmer of hope? What does science have to say about it? All these questions and more will be answered. So, stay tuned as we delve into the world of type 2 diabetes. But first, it's essential to understand what type 2 diabetes is. Picture this. Your body is a well-oiled machine that runs on fuel, and this fuel is glucose or sugar. Now, to use this fuel effectively, your body needs a key: insulin, a hormone produced by your pancreas. In a healthy body, insulin unlocks the cells, allowing glucose to enter and be used as energy. But what happens when the key doesn't work? This is where type 2 diabetes comes into play. In type 2 diabetes, your body becomes resistant to insulin. Imagine trying to open a locked door with a key that's slightly warped. It's a struggle, isn't it? That's exactly what happens here. Your cells resist the insulin, making it difficult for glucose to be absorbed. This is known as insulin resistance. Now your pancreas is like a key maker, and it tries to solve this problem by producing more and more insulin. But over time, it simply can't keep up. The keys or insulin it produces are less effective, and eventually, it may not produce enough. So what happens to all the unused glucose? Well, it stays in your bloodstream, leading to high blood sugar levels. This is like a fuel leak in our machine analogy. And just like a fuel leak can damage a machine, high blood sugar levels can have harmful effects on your body. Over time, high sugar levels can damage your blood vessels, leading to heart disease, stroke, kidney disease, and even vision problems. It's like a domino effect, one issue leading to another, disrupting the harmony of your body's functions. All this might sound a little overwhelming, but don't fret. The purpose of understanding type 2 diabetes is not to scare you, but to equip you with knowledge. Knowledge that can help you take the right steps towards managing this condition, and perhaps even reversing it. Knowing this, we can now explore the possibility of reversing this condition. So, can you reverse type 2 diabetes? The answer is not as simple as a yes or no. Now, we're stepping into an area of ongoing debate, a topic that has sparked countless discussions among medical professionals, researchers, and patients alike. Can type 2 diabetes really be reversed? Well, let's unpack this a bit. Some experts use the term reversal to describe a situation where a person with type 2 diabetes can achieve normal blood sugar levels without the need for medication. Then there are others who prefer the term remission, which implies a temporary state of normal blood glucose levels, but with the potential for the disease to return. And then, there's the matter of how one might achieve this so-called reversal or remission. Some say it's all down to lifestyle changes. Things like adopting a healthy diet, engaging in regular physical activity, losing excess weight, and maintaining consistent sleep patterns. And there is some evidence to back this up, with studies showing that significant lifestyle changes can indeed lead to improved blood sugar control, and in some cases, even remission. On the other side of the coin, there are those who advocate for medical interventions. These may include medications, insulin therapy, and even bariatric surgery. But while these methods can effectively manage the disease, the question remains, do they actually reverse it or just keep it at bay? You see, the challenge lies in the nature of type 2 diabetes itself. It's a chronic condition, meaning it's long-lasting and typically progressive. So, while lifestyle changes and medical interventions can help manage the disease, they may not necessarily eliminate it completely. But here's the thing. Even if we can't conclusively say that type 2 diabetes can be reversed, we can say this: it can be managed effectively, and for some, it may even enter a state of remission, where the symptoms are absent and blood sugar levels return to normal. While there is no definitive answer, many believe that type 2 diabetes can be managed effectively and in some cases even reversed. And one of the most significant factors in managing and potentially reversing type 2 diabetes is lifestyle modification. Now, what does lifestyle modification entail, you ask? It's a three-pronged approach involving diet, exercise, and weight loss. Let's start with diet. The phrase "you are what you eat" rings especially true for individuals with type 2 diabetes. A balanced diet is not about depriving yourself of the foods you love, but about making healthier choices more often. This includes eating a variety of foods in the right proportions. Think lean proteins, whole grains, fruits, vegetables, and healthy fats. The key is to control portion sizes and ensure your meals are balanced and nutritious. Now, on to exercise. Regular physical activity plays a crucial role in managing diabetes. It aids in controlling blood sugar levels and reducing heart disease risk factors. But don't worry, you don't need to run a marathon or lift heavy weights. Simple activities like brisk walking, cycling, or swimming can make a huge difference. Aim to get at least 30 minutes of moderate intensity physical activity on most days of the week. Remember, every bit of movement counts. The third pillar of lifestyle modification is weight loss. Losing even a small percentage of your body weight can have a significant impact on your blood sugar control. However, it's important to approach weight loss in a healthy and sustainable manner. This is not about crash diets or extreme measures, but about making long-term changes to your eating and exercise habits. It's also worth mentioning that lifestyle changes can be challenging to implement and maintain. It's okay to have off days. The important thing is not to give up. Seek support from healthcare professionals, friends, and family to help you stay on track. Lifestyle changes are a crucial step in the journey towards managing and potentially reversing type 2 diabetes. So take that first step today. Your health is worth it. In addition to lifestyle changes, medical interventions also play a key role. When it comes to managing type 2 diabetes, medicines and surgical procedures are often employed to help control blood sugar levels, prevent complications, and improve quality of life. Let's delve a bit deeper into these medical interventions. Medications are typically the first line of defense. There's a wide array of drugs available, each working in a unique way to lower blood glucose. Some stimulate the pancreas to produce more insulin, others slow down the absorption of carbohydrates from the food you eat, and yet others improve the effectiveness of insulin in your body. Insulin therapy is another common approach, especially for individuals who can't manage their blood sugar levels through oral medications alone. Insulin can be injected daily or delivered through an insulin pump. Then, there are the GLP-1 receptor agonists. These injectable medicines slow digestion and help lower blood sugar levels. They also assist in weight loss, which is beneficial in managing type 2 diabetes. But what about surgical interventions? Bariatric surgery, also known as weight loss surgery, has shown promising results in managing and even reversing type 2 diabetes in some cases. This surgery reduces the size of the stomach, leading to decreased food intake and weight loss. As a result, the body's insulin needs decrease, helping to better regulate blood sugar levels. However, it's important to note that every medical intervention comes with its own set of risks and benefits. What works best varies from person to person depending on factors like the severity of the disease, age, overall health, and personal preferences. So whether it's taking a pill before meals, injecting insulin, or even considering weight loss surgery, remember that these interventions are tools in your toolbox. They're there to help you manage your condition, but they're most effective when combined with the right lifestyle changes. With the right medical intervention, combined with lifestyle changes, individuals with type 2 diabetes can lead a healthy life. So, the question remains, can you reverse type 2 diabetes? We've taken a deep dive into understanding this complex health condition and the possibilities of reversal. We've explored that type 2 diabetes is a chronic condition characterized by the body's inability to effectively use insulin. We've also discussed the potential for reversing the condition. It's important to remember that while the term reversal may suggest a complete cure, in the context of type 2 diabetes, it typically means achieving blood sugar levels within the normal range without the need for medication. This doesn't mean the disease has disappeared entirely, but it's under control to the point where it doesn't pose a significant health risk. We've highlighted the role of lifestyle changes like maintaining a healthy diet, regular physical activity, and weight management in controlling and potentially reversing type 2 diabetes. But remember, everyone's body responds differently, and what works for one person may not work for another. We've also touched upon medical interventions including medication and surgery, which can be effective tools in managing the condition, especially when lifestyle changes aren't enough. In conclusion, while there's no definitive answer to whether you can fully reverse type 2 diabetes, what we do know is that effective management is absolutely possible. It's all about finding the right combination of lifestyle modifications and medical interventions, tailored to you. Remember, it's crucial to consult with a healthcare professional for personalized advice. And if you enjoyed this video, please subscribe to our channel for more insightful content.